More than 13 million people in the United States have been diagnosed with heart disease caused by blockage of the arteries in the heart. 1.8 million of them will undergo a procedure to open or bypass these blockages. One procedure for opening blocked arteries is called balloon angioplasty. During balloon angioplasty, a catheter is guided into the blockage in the coronary artery and inflated to allow more blood to flow through the artery. While angioplasty is effective for some patients, 30 to 50% of patients experience re-narrowing of the artery within 6 months, called restenosis. This occurs because balloon angioplasty can stretch and injure the artery walls, causing scar tissue to grow and re-block the artery. Until now, the most promising treatment for recurring blockage has been the insertion of a metal implant called a stent to support and hold open the artery wall. However, stents are believed to irritate the artery, causing new cell growth and recurring blockage.
Stents have been a great benefit in angioplasty over the past several years. They do reduce the chance of the blockage coming back in an angioplasty procedure, but they are not the final answer. There is still the possibility that the scar tissue that forms on the interior of the artery can grow through the stent and re-obstruct the lumen or the opening of the artery by forming that scar tissue through the struts or the meshwork of the stent.
Novoste Corporation has developed an experimental device called the Betacath System, which uses a temporary dose of small amounts of beta radiation to limit new cell growth inside the artery and help prevent recurring blockage. Here's how it works. Immediately following balloon angioplasty, a second catheter is inserted to the site where the angioplasty was performed. Markers on the catheter allow your doctor to position the catheter at the previous angioplasty site before treatment begins. Then, the radiation seeds are delivered through the catheter to the treatment site. The seeds remain inside the catheter and do not come in contact with the patient's blood or tissue. In less than 5 minutes, the area is treated and all of the radiation is removed from the body.
The amount of radiation they receive as a result of the Betacath procedure is minimal. We usually equate that to the equivalent of a chest x-ray during a routine doctor visit.
The entire procedure using the Betacath system takes less than 10 minutes, and there are no known additional risks beyond the angioplasty.
There is really no additional pain or anything that the patient feels when they undergo a Betacath procedure. There is a small amount of additional time required to place the catheter and remove it, but that usually can be done in no more than 5 extra minutes during the procedure. The patient is sedated but not under general anesthesia, as is the norm for all of our angioplasty procedures, and they really don't have any knowledge of, even when we put the Betacath catheter down the artery versus the standard balloon angioplasty catheters when they're in the artery.
Novoste is currently enrolling patients in clinical studies to test the effectiveness of the Betacath system.
The patients enrolled in this study will receive the standard benefit of their angioplasty procedure. That part of their care will not be altered in any way. The potential additional benefit is that they may end up in the arm of the study in which patients are assigned to receive the active radiation dose. If the study is constructed in a scientific manner, it has to be done randomly, but should the patient receive active radiation, our hope is that the benefits of the radiation will prevent their need for coming back for another angioplasty within 6 months following their initial procedure.
The Betacath system can be used when a stent is already in the artery or when a new stent is being placed. The procedure adds less than 10 minutes to a normal angioplasty. There is no additional medical cost to the patient to participate in the study.